The environment has to be
What we are saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be bigoted about bigots. I'm fine with that.
What's wrong with Singaporeans?
Dr. Rahul.
Yeah, I think I have three things to say. The first being that with the other panelists have also raised that if we don't do anything about obesity, we'll see a gradual increase in the prevalence, which is kind of the number of people who have chronic diseases, cancer, type 2 diabetes, heart attacks, and other things. And we've been, I guess, seeing that from in other countries, the US and others. The second thing is that it also has a big economic aspect to it. Obesity is a costly disease. Once a person develops a particular condition, there are associated medical costs, there are kind of costs that are associated with providing care to that particular person subsequent to the medical issues, both kind of formal as well as informal costs associated with it. And the third, coming out of research from Duke in the US, from one of my colleagues, shows that obesity also reduces the productivity of people who are working. So it's not only absenteeism, which is people not being able to work, being off, but also something called as presentism, in which they're present at the job, but they're not as productive.
Okay.
So there is kind of the health aspect, and I think intimately linked to it is the whole economic aspect of obesity, which we should be mindful of.
Okay. Kalpana.
Their self-esteem is low. So once their self-esteem is low, again, automatically the productivity also decreases. And Derek also pointed out that mental health. So many of the patients who are obese or subjects who are obese also have higher chance of getting depression, then going into schizophrenia. That is the latest research as well. Because now currently I'm working with IMH, mainly looking at obesity and schizophrenia, how they are linked.
And you're saying that if you're obese and you go into depression, that can segue into schizophrenia?
Yes.
Isn't schizophrenia a predisposition?
In certain cases, yes.
Predisposition?
But usually in the schizophrenia comes usually in the prevalence rate is mainly in the younger age group, around 15 to 30, and that's when people also mainly are bothered about the body image and self-esteem and so on.
Okay. The consequences of an obese nation, of if we do nothing, we haven't succeeded in reducing the level of obesity, but like the good doctor says, that it could have been worse if we didn't have all these campaigns. My question is that can we afford not to allow or do something drastic about growing obesity in Singapore? What are the consequences if more and more people become obese in Singapore?
Firstly, your risk of getting type 2 diabetes is enormously increased. Secondly, also risk of getting cancer is increased. Thirdly, women that get pregnant have a greater risk of both morbidity and mortality. But fourthly, I think there is a reason of actually being able to perform physically. But there I want to bring another sort of a shift of paradigm in saying there's a school of thought that maybe we have also sometimes overblown, forgive my pun, the whole pandemic of obesity. Meaning, if you're fat and fit, you're very
Is there such a thing?
Absolutely.
Yes,
Absolutely.
yes,
And there's a chap called Steve Blair in Texas who's been saying, hey guys, you probably are shouting too much about this obsession of being obese. If you're fat but fit, there is no risk.
You're going to undermine all the work of the
I
campaign.
know, but I think in this kind of program, we have to shift paradigms as well, because what you don't want to end up is being another Me Too guy saying the same old mantra. And I'm saying, just look at this.
What is fat and fit?
I'm not demeaning the importance of obesity. I'm simply saying obesity may be sometimes over-exaggerated in its importance and relevance. I'm hearing nods.
Professor, sorry, would you say that some people are fat because they are genetically fat from
No doubt.
family?
No doubt. But the caveat to that is that you must not say, oh, my grandmother and my mom were fat, I'm going to be fat, I'm destined to this. But I'm simply saying, let's look at what we can do, what we can't do, but actually also have a sense of what this young lady has been saying. If you're slightly overweight, the question is that do you want to reduce the risk of type 2 diabetes? But if you're fat but fit, you have little or no increase in risk. And I think I can see lots of the nutrition and diet is also echoing what I'm saying, which I think is a slightly different twist to your audience of saying, and I don't like to see skinny women. On that note, I must love you and leave you.
Bye.
Thank you. Thank you very much.
Thank you.
Thanks, Professor. But let's have opinions from the other panelists.
There is a kind of a different sort of movement and thinking. In Australia, they call it the health at every weight movement, and I think some of you may be aware of it. It's possible to be healthy at every weight, provided you've done your best in terms of your lifestyle, and you just accept that perhaps you may be of a certain weight, rather than trying to be unrealistic to go to a weight that genetically you probably couldn't reach.
That's the norm for each individual.
Norm for each individual, and rather than insisting that everyone becomes BMI 25 or BMI 23, which I think is maybe quite unrealistic for some people. Yeah, so for a patient, if he comes in at 100 kilos, and if he can lose like 5 to 10%, he can get to 95 or 90 kilos, that's actually very good. And already the risk of cardiovascular diseases and all the chronic diseases drops significantly just by 5 to 10%. So we're not even asking them to go to BMI 25, because some people will never be at BMI 25 their whole life. Yeah. In fact, if they try to get there, they'll go into eating disorders and stuff like that. So I think there's a more of a thinking that we accept that people will be around a certain weight, but rather than focusing so much on that number, but we focus on wellness, on what the person is doing to keep a healthy lifestyle. So exercise, eating well, being mentally well as well.